Now to the coronavirus surge here in Kern County. Public health officials reporting today 284 new cases and 2 new deaths. More than 9,000 people are now recovering from the coronavirus at home, while 79 remain hospitalized with more acute symptoms. To date, 447 people in Kern County have died from COVID-19. Public health says the latest spike is more intense than the first wave at the beginning of this pandemic. Now, the surge is a Thanksgiving threat as well, but the increase is not just happening here in Kern, it's happening all over the country. 17's Alex Fisher joining us now in studio to talk about our local numbers, but also about what the rest of the state and country looks like right now. Alex?
Well, Jen, the surge is a major concern from health officials from our local health department all the way to Washington. Now, this increase is happening at a very critical moment. It's right before the holidays when most of us gather with others. Now, here's a look at our curve. You can see where we are right now. We have our case rate average is now 311 cases. That's up about 21 from where we were yesterday. And if you follow this yellow line, you can see on the other side of the first surge that we saw was June 26th. So we're kind of right here. We're going upwards, and it looks like we're going to continue on this trend for several more weeks, if not months, depending on how people prevent the spread of coronavirus, especially during the holidays. So that's where we are right now. Again, we're talking about Thanksgiving, so let's show you the hot spots in California. A lot of people are taking to the roads. They may be traveling to other counties to see family and friends. Here are the hot spots, the most infectious counties, according to our state health department, over a 3-day average. And you can see kind of up and down California, but several counties are in Southern California. So if you're going to be heading to Ventura, San Bernardino, or Los Angeles counties, those are going to be in the top 5. So something that you need to be definitely aware of. Kern County is 15th on that list. So although things are still bad here in Kern County, other parts of the state are actually seeing a higher infection rate, which is very concerning to health officials, of course. Now, I showed you this yesterday. I want to show it to you again, talking about the gathering forecast, if you will, and this is what our health officials talk about when it comes to the gathering in the household. So this model is from Georgia Tech. They had developed this model a couple of weeks ago, and it's changed slightly for Kern County. As you can see, if you in Kern County are going to be gathering with 10 people, you have about a 15% chance that someone at your gathering could be infected with coronavirus. Going all the way up to 50, of course, that is a very large gathering. According to the Georgia Tech model, as of today, you have a 55% chance of someone at your household being infected with coronavirus. So it hasn't changed much, but again, this is a model that that changes every single day. It's on that upward trend as we get closer to Thanksgiving, Jen. Okay, so folks who are traveling across the country for Thanksgiving, where are the hot spots outside of every airport, I imagine you go into, but what are the hot spots? Well, we should talk about, we've been talking about this surge, this third surge, as they say, across the nation for weeks now, if not maybe a couple of months. We were kind of the last in California to see this surge. So if you are traveling, the hot spots across the country right now, the Dakotas, Wyoming, New Mexico, and Minnesota. According to the, I know that's your home. I know that's your hometown or your home state, but that's what the CDC says as of today. Those are the top 5. Now, of course, there are other states that are worse than California. In fact, just to put this in perspective, we talk about how the coronavirus is spreading in California. According to the CDC, there are 41 other states that have a higher infection rate than California. So things across the rest of the country not looking too good. Okay, I know you don't have a crystal ball that contains the answer to this, but what are the models suggesting about this surge? How long are we going to see this continue? The models we've heard from our health department, they say you have to take it with a grain of salt. You can't follow it like it's, the rule of law. However, I just talked to our health officials, our health department, just a few moments ago, just to get an update. They say we're going to see this increase, according to the models that they follow, through February, early February. That's several months. That means that this peak is going to be bigger than the one that we saw in the summer times. Okay. However, the good news here, I want to end on a positive note, we have the opportunity to slow the spread, according to our health officials, following the social distancing guidelines and wearing a mask, wash your hands, so forth. And we're making great strides in the research front on vaccines and so forth, yes. Alex, thanks as always. Appreciate it.